I want you to picture something for a second. It's the middle of July. You're sweltering on a hot summer day, the kind where the heat is it's radiating off the pavement.
Yeah, just absolutely brutal heat.
Right. And you finally get your hands on a freezing cold, brightly colored popsicle. So you're sitting there eating it, trying to beat the heat, and a thought suddenly crosses your mind. You think, wow, this icy treat right here, this could completely revolutionize the multi-billion-dollar cosmetic surgery industry.
I mean, it sounds completely absurd when you phrase it like that. It really does.
It makes zero logical sense.
No, it sounds like the kind of wild connection someone makes after they've had, far too much sun and not nearly enough water.
Exactly. On the surface, it is ridiculous. But that is exactly the journey we're going on today for this deep dive. We are exploring the scientific genesis and the evolution of cryolipolysis.
Or, as you probably know it from literally every billboard and beauty magazine, fat freezing.
Fat freezing, yes. And our mission today is to actually trace the biology here, We want to look at how a highly specific and, frankly, kind of weird childhood quirk observed decades ago managed to morph into this.
Into one of the most recognized, globally utilized body contouring technologies in the world.
Yeah. So to do that, we've pulled together a whole stack of comprehensive medical texts and historical documentation detailing the origins of this treatment.
Because the goal here is to cut through the modern-day beauty trend type.
Right. We want to get past the glossy brochures you see sitting in waiting rooms and actually look at the rigorous scientific foundation that makes this whole thing possible.
Because beneath all that marketing, there really is a profound biological mechanism at play. I mean, this is fundamentally a story of observation.
Yeah.
It's about asking the right questions and understanding how our body's cells respond to environmental stress in incredibly selective ways.
So let's get into it, because to understand the sleek, futuristic cosmetic clinics of today, we actually have to travel back in time a bit.
We do. We have to go back to the pediatric clinics of the 1970s.
Okay, so paint that picture for me. What was happening in those doctors' offices?
Well, picture a pediatrician's office in the 1970s. Physicians started noticing this very peculiar pattern among a specific subset of their young patients.
Like a recurring symptom.
Yeah, exactly. They were seeing children who frequently sucked on icy poles or popsicles. And these specific children were developing temporary dimples and actual localized areas of fat loss right in their cheeks.
Wait, temporary dimples just from eating a popsicle?
Just from the prolonged exposure to the cold of the popsicle resting against the inside of their cheek.
Oh, wow.
Yeah, because when you suck on an icy treat, it sits in one specific spot for a fairly extended period.
Right, kids kind of just leave it parked in their cheek.
Exactly. So the medical community observed this, they documented it, and they gave this unusual condition an official, slightly intimidating name. They called it popsicle panniculitis.
Popsicle panniculitis. Okay, let's break that down, because panniculitis is one of those medical terms that sounds a lot scarier than it actually is, right?
It is, yeah. Panniculitis is simply the medical term used to describe an inflammation of the fatty layer that sits just beneath the skin.
The subcutaneous fat?
Precisely.
Yeah.
So in these kids, the cold from the popsicle was inflaming that specific fat pad in the cheek.
But here's what I don't get. If a child has a freezing cold popsicle against their cheek, the cold is hitting the inside of the mouth, it's radiating through the skin, the muscle, everything.
Right.
Why wouldn't a cold just damage the skin first? I mean, it's right there.
And that is the exact question that made this observation so crucial. That was the real aha moment for these 1970s physicians.
Really?
Yes. They noted that while the surrounding skin itself remained largely unaffected. It wasn't damaged, it wasn't getting frostbite and dying off, it was perfectly fine.
So the cold hits the cheek, the skin just shrugs it off, but the fat reacts. Why? They are right next to each other, experiencing the exact same temperature.
Well, it comes down to their cellular composition.
Yeah.
Think about what skin tissue is primarily made of.
Mostly water, right.
Right. And fat cells, or adipocytes, are mostly comprised of lipids, oils.
Okay.
These two substances, water and lipids, have entirely different freezing points and different thresholds for cold exposure.
Oh, okay. Wait, so is this basically like putting a vinaigrette in the fridge?
A vinaigrette.
Yeah, like if I have a jar of homemade salad dressing, olive oil and vinegar, and I leave it in the cold fridge.
Oh, I see. The olive oil solidifies.
Yeah, the oil gets all clumpy and cloudy, but the vinegar, which is mostly water, stays completely liquid. Is that essentially what's happening in the cheek?
That is essentially the exact mechanism at play, yeah.
That's
The
wild.
lipid-rich fat cells in the cheek are the olive oil in your salad dressing. They respond and structurally change at a temperature where the water-rich skin cells, the vinegar, just sit there completely unbothered.
Because lipids crystallize at a much higher temperature than water does.
Exactly.
That is fascinating. So a kid eats a popsicle, the temperature in the cheek drops just enough to turn the olive oil solid, but not enough to freeze the vinegar.
You've got it.
But here's the thing. For a long time, this was just a quirky medical fun fact, right? Like just a weird thing pediatricians knew about. Hey, don't let your kid eat too many popsicles or they'll get a cheek dimple.
Yeah, pretty much. It remained a quirky fun fact for almost 30 years. Science often works like a slow-burning fuse.
30 years?
Yeah, that 1970s observation just sat there in the medical literature. It wasn't until the early 2000s that someone finally looked at that old data and asked a massive, potentially industry-changing question.
And what was the question?
Well, if fat cells are uniquely sensitive to cold, could we use controlled cooling to selectively target and reduce fat cells elsewhere in the body?
Oh, wow.
Could we do it without damaging the surrounding tissues? And most importantly, could we do it without surgery?
Okay, so we have this weird medical trivia from the 70s. Who actually decides to test this and try to turn it into a clinical reality?
This is where we move to the absolute cutting edge of medical research. Early 2000s. We're talking about researchers at Harvard Medical School and Massachusetts General Hospital.
Okay, heavy hitters.
Specifically, two key figures, Dr. Dieter Manstein and Dr. R. Rock Sanderson. They and their research team decided to rigorously test this popsicle hypothesis.
I mean, you don't get much more prestigious than Harvard and Mass General.
You really don't. And they didn't just look at skin versus fat. They had to prove this comprehensively.
Right.
They conducted studies that demonstrated fat cells were not just more sensitive to cold than skin, but they were more vulnerable than muscle tissue and more vulnerable than nerve tissue as well.
So you could theoretically apply cold to a specific area of the body, and the skin, the nerves, the blood vessels, the muscles, they would all just power through it.
Yes.
But the fat cells would essentially throw in the towel.
That was the theory of selective cryolysis. But the biological breakthrough here wasn't just that the fat cells were vulnerable. The real discovery was how the fat cells actually responded to the cold.
Because it is not what most people think, right?
Hello.
Yeah, because when I hear the phrase fat freezing, my mind immediately goes to an extreme visual. Like I picture liquid nitrogen, you spray it on, the fat cell turns into a solid ice cube, it shatters into a million pieces, and boom, the fat is gone.
Oh, if that happened inside your body, it would be incredibly dangerous.
Really?
Oh, absolutely. You would be dealing with massive tissue necrosis and a severe inflammatory response. It would be a disaster.
Okay, so no shattering ice cubes.
No. What Dr. Manstein and Dr. Anderson discovered was much more elegant. They found that carefully controlled cooling doesn't instantly freeze and shatter the fat cells. Instead, it triggers a biological process called apoptosis.
Apoptosis?
Yes. In the medical field, apoptosis is referred to as programmed cell death.
Okay, hold on. Let's unpack this. Programmed cell death. You're saying that, like, it's a gentle, everyday thing. To me, that sounds like a terrifying sci-fi self-destruct sequence, like you're hitting a red button inside the body.
I get that.
If these cells aren't just instantly freezing and shattering like ice, how does a localized die-off of tissue not send the body into total shock?
It's a very fair question because the terminology sounds aggressive. Programmed cell death. But apoptosis is actually the exact opposite of a chaotic sci-fi explosion. Think of it as a highly organized, polite dismantling of the cell.
A polite dismantling. I like that.
It happens in your body every single day. Cells get old, they reach the end of their life cycle, and they undergo apoptosis.
So it's a normal function.
Completely normal. They quietly package themselves up into tiny fragments. In the case of cryolipolysis, the cold exposure, that crystallization of the lipids we talked about, damages the structure of the fat cell just enough to send a signal.
Like a structural warning.
Exactly. It tells the cell, your time is up.
So the cold doesn't kill the cell instantly. It just gives it the signal to shut itself down.
It's exactly right. The cell then gradually breaks down over a period of weeks or even months.
And because it's gradual, the body doesn't freak out. It doesn't trigger a massive emergency immune response.
Right. It triggers a very slow, managed response. Your body has a natural waste removal system, specifically the lymphatic system.
Okay.
Once those fat cells politely package themselves into fragments, specialized white blood cells called macrophages come in.
Macrophages.
They engulf these cellular fragments, process them, and the lymphatic system slowly clears them from your body. It's a completely natural biological clearance, just triggered artificially by the targeted cold.
Okay, so the Harvard team cracked the biological code. They proved that if you cool the subcutaneous fat just enough, you cause those lipids to crystallize.
Yes.
That triggers this quiet, polite, self-destruct sequence apoptosis while leaving the water-based skin, nerves, and muscles completely unharmed.
That was the turning point. The underlying science was structurally sound. But, knowing how a biological mechanism works in a controlled laboratory setting is very different from offering a safe, reliable treatment to the general public.
Well, for sure. Right, because you can't just hand a patient an ice pack and tell them to hold it against their stomach for an hour.
Definitely not. If you did that, you'd likely cause severe frostbite to the surface skin before you ever triggered apoptosis in the deep fat layers.
Because the skin is touching the ice directly.
Exactly. Plus, an ice pack wouldn't maintain the exact specific temperature required. It fluctuates. So the challenge shifted entirely from biology to engineering.
How do you build a machine that can do this? Well, before we get to the actual devices, let's look at the name they gave this new procedure, because the name itself is basically a blueprint for what the engineering had to accomplish.
Cryolipolysis.
Right. Let's break down that word, because if you understand the name, you understand the exact science of how this works. It's made of 3 key components. First, you have cryo, which means cold. Then you have lipo, which means fat. And finally, lysis, which means breakdown.
Put it all together, and it translates literally to the breakdown of fat using cold temperatures.
It does exactly what it says on the tin. But delivering that cryo safely, how did the engineers solve the frostbite problem?
It was tricky.
I mean, if the skin is sitting directly between the cooling machine and the fat, how do you protect the skin from dropping to dangerous temperatures?
Well, following the successful clinical studies by the Harvard team, engineers developed specialized cooling devices that relied on a few key innovations. First, they didn't just use flat, cold plates.
Okay.
They built complex applicators that used a vacuum mechanism.
A vacuum, like suction.
Yes, exactly like suction. The applicator is placed on the body, and it actually pulls the targeted pocket of fat up into a hollow cup.
Wait, why pull it into a cup? Why not just press it against the skin?
Because if you just press a cold plate against the stomach, you are fighting against the body's core temperature. Your body is constantly pushing warm blood to that area to keep it at 98.6 degrees.
Oh, so the body is fighting the machine.
Exactly. By using a vacuum to pull the fat tissue away from the core muscles and up into the applicator cup, you isolate it. Then, cooling panels inside the cup deliver a highly controlled, incredibly precise level of cold from both sides simultaneously.
Okay, that makes sense. You isolate the fat so you can cool it more efficiently. But you still haven't solved the skin problem.
Sure.
The skin is still touching those cold panels inside the cup, right?
That's where the second major engineering innovation comes in. Anti-freeze gel pads and thermal sensors.
Anti-freeze, like what you put in a car.
Different chemical makeup, obviously, but a similar principle. Before the applicator is applied, a specialized gel pad is placed over the skin.
Okay.
This pad is saturated with a solution that protects the epidermis, the outer layer of skin. It allows the cold temperatures to pass through and penetrate deeply into the fatty layer while preventing the surface skin itself from freezing.
That is incredibly clever.
And it is paired with thousands of thermal sensors built into the applicator itself.
Thousands?
Yes. These sensors constantly monitor the skin's surface temperature throughout the entire treatment. If the skin gets even a fraction of a degree too cold, the machine instantly adjusts or shuts off.
So it's an active, dynamic process. It's not just, setting a freezer on a timer.
Not at all.
The machine is constantly reading the body and adjusting to ensure it only hits the specific threshold for lipid crystallization without ever crossing the line into skin damage.
Exactly. And the evolution of these applicators is a fascinating story in itself. The very early systems were relatively bulky.
Because they needed that vacuum suction.
Right. Because of the vacuum design, they required a decent amount of pinchable tissue to work. So they focused primarily on reducing large, stubborn fat deposits. We're talking about the abdomen and the flanks.
What most people affectionately call love handles, the wider, relatively flatter areas of the torso.
But as the popularity of the treatment started to grow, people were seeing results on their stomachs and asking their doctors, hey, what about this other spot? Can you use this on my arms?
And this is where the engineering really had to accelerate, right? Because a bulky cup designed for a stomach isn't going to fit on an arm or a chin.
Exactly. They had to develop entirely new technologies and much more advanced treatment systems. The applicator designs became highly specialized for different curves and contours of the human body.
Making them bespoke for different body parts.
Yeah. Over time, they moved far beyond just the abdomen. They developed specific applicators for back fat, for the bra bulge, for the upper arms.
I read they even engineered applicators that could safely treat the inner thighs, and then completely different flatter applicators for the outer thighs because the fat sits differently there.
That's true. They eventually developed tiny, highly precise applicators to target the very small pockets of fat under the chin.
It's just wild to think about that progression. We went from accidental cheek dimples in kids eating popsicles to precision targeting a bra bulge or a double chin with thermal sensors.
Well, it's quite the leap.
It's almost like going from, accidentally leaving a window open in winter and noticing the room gets a bit drafty to inventing a highly calibrated, targeted, smart HVAC system that controls the temperature of specific corners of a house.
That's actually a very accurate analogy.
Yeah.
The underlying principle is the exact same cold air, but the delivery mechanism has been refined to an extraordinary degree of precision and safety.
Right.
And we have to look at why this engineering effort was so intense. I mean, why did so much money and research go into perfecting these applicators?
Well, it was driven by massive market demand, wasn't it?
Huge demand.
Yeah.
People wanted this technology badly. Think about what the alternative was at the time. Historically, if someone had a stubborn pocket of localized fat that simply wasn't responding to diet or exercise, their primary option was surgical, liposuction.
Which is a major, major procedure. That means general anesthesia, incisions, significant physical downtime, and a whole host of surgical risks.
Exactly. The demand for non-surgical body contouring treatments was skyrocketing. People were actively seeking alternatives to liposuction that didn't require going under the knife.
And cryolipolysis stepped into that void perfectly. It offered a completely non-invasive option. There were no needles, there were no incisions.
And minimal downtime. Because of the way apoptosis works, the body does the clearing out slowly over weeks. You could theoretically go into a clinic, have an applicator attached to your abdomen for an hour while you read a book or answer emails, and then get up and go right back to work.
That level of convenience is unbeatable. And combined with the fact that it was built on a foundation of rigorous scientific research from institutions like Harvard, that made it incredibly attractive.
Very much so. Not just to the clients who wanted the treatment, but to the practitioners, the doctors and clinic owners who wanted to offer it safely.
Which brings us to the landscape today. Cryolipolysis is now recognized worldwide as one of the absolute leading non-invasive body contouring treatments on the market.
It really has transcended its quirky pediatric origins entirely. You'll find these highly engineered machines in beauty salons, specialized body contouring clinics, high-end medical aesthetic clinics, and traditional cosmetic surgery practices across the globe.
It really has become a cornerstone of the modern aesthetic industry. And I think, honestly, that is what is so crucial to take away from this discussion.
Absolutely.
When you actually take the time to understand the history and the biology of cryolipolysis, you gain a real appreciation for the fact that fat freezing is not simply a passing beauty trend or a marketing gimmick.
No, it's a meticulously developed medical treatment. It is built upon decades of research into the fundamental biology of how our cells respond to controlled environmental stress.
It required the sharp observation of 1970s pediatricians noticing something weird about kids eating popsicles.
Right.
It required the rigorous scientific inquiry of Harvard researchers in the early 2000s to actually understand lipid crystallization and apoptosis.
And it required the continuous, complex technological innovation of modern engineering to build vacuum applicators and thermal sensors to make it safe.
It really highlights how interconnected basic medical observation and advanced technological innovation truly are.
It does. It's a perfect example of that synergy.
So as we wrap up our deep dive into the world of cryolipolysis, I want to leave you with something fascinating to mull over as you go about your day.
Oh, I like these.
We've seen how a simple observation of a child eating a summer treat eventually revolutionized the entire cosmetic surgery and body contouring industry. It begs a rather large question.
What's that?
What other seemingly mundane, everyday phenomena are happening right in front of us at this exact moment?
That's a good point.
I mean, what quirky little reactions is the human body having to our everyday environment, just waiting for the right observant mind to notice them, ask why, and turn them into the next massive medical breakthrough?
It certainly makes you look at the mundane details of the world a little differently.
It really does. So the next time you're sweltering on a hot July day and you reach for that freezing cold popsicle, just remember you might be holding the key to the next great scientific leap right there in your sticky hands.